And the real issue is, and this is where, again, a psychologist would be really essential, from the diagnosis of the prostate cancer to the treatment process, is to actually give a realistic expectation of how the changes in one's sexuality will occur. Because sexual lifestyle does change, and erectile function does change, and it's different. And that's the best way to describe it, is it becomes different. There may be a change in ejaculatory function, there may be a change in ejaculation totally, there may be a change in the rigidity or firmness. And also sexuality is not just about sexual intercourse, and that's where counseling is really essential and really beneficial for a lot of couples in couples therapy. And that's one of the things that I would really love to see change as time moves on, as we move into the real world and taking care of patients as a whole, vis-a-vis a panel like this, versus just as a urologist or as a radiation oncologist, because we need to take care of our entire patient, not just one aspect. And so for erectile function, back when I was learning how to do radical prostatectomies, Pat Walsh used to always say, he was the guru for the nerve-sparing radical prostatectomy at Johns Hopkins, and he said, wait 8 months, don't worry about their sexuality, wait 8 months after surgery, and then you counsel them. And I thought, that is baloney. What do you mean 8 months? We could tell some guys sit there for 8 months and twiddle their thumbs or play tiddlywinks. I mean, you got to get back in the action right away. And so subsequently, we got a lot smarter, not necessarily better, but we did get smarter. And we now counsel men and couples to get sexually active. For a while, I know in our practice, we have a nurse practitioner who gets intimately involved with our patients to teach them how to cycle their erections by using a vacuum erection device. That has only proven to be partially effective for most men and hasn't been as effective as we would like. And penile injection therapy is another option that we use quite a bit of and was first made popular back in the early 80s. But the reality is it's not the same as the normal mechanism of gaining an erection through visual personal stimulation. And so the key thing is to have that discussion about how sexuality can still be there, but it's going to be different. And intimacy will still be there depending upon your relationship, and maintaining a really intimate relationship with your partner and having that discussion.